Good evening. An estimated 5 to 15% of people in the U.S. contract the flu every year. And just this past year, the CDC says the virus caused more than 100 deaths in Pennsylvania alone.
Now, hospitals across the country are doing what they can to prevent the spread of the virus. In 13 states, flu vaccine already a requirement for all healthcare workers. Local hospitals taking notice. And Maria Miller talked with doctors at Conemaugh Hospital today, where that requirement was just put into place.
It is a preventable illness, and it causes about 24,000 deaths in the country and more than 200,000 admissions.
The statistics for influenza in the U.S. are staggering, but so are the reported results of the vaccine against it. Doctors at Conemaugh Health Systems say research shows for every 15 healthcare providers who get vaccinated against the flu, one fewer person in the community will contract the virus. It's part of the reason why the health system has joined hundreds of other hospitals who already mandate flu shots for all employees.
The universal flu vaccine would actually have less employee absenteeism, as well as reduce healthcare costs and, of course, patient safety. Even before Duke LifePoint came in, we were already going to mandate the flu vaccine to all employees.
And that means all employees, including those who are pregnant. Doctors say it's incredibly safe, and in fact, the CDC actually encourages pregnant women to get a flu shot. But of course, there are many people who strongly disagree.
I don't think it should be forced on anybody to take it, regardless if you were at the hospital or not.
Melinda Rivera has a few family members who work at Conemaugh.
I know my daughter is against it, but since it's mandatory, she has to get it done.
Dr. Gisbert says she's already received a flood of phone calls from upset employees, others downright angry about the new mandate. So what happens for those who say no?
Well, it's mandatory condition for employment, so we have until November 15 for us to get the flu vaccine or
Termination.
Correct.
The doctors and the officials with the CDC say you can't get the flu by getting the vaccine. They say that's just a myth. Still, an overwhelming amount of people disagree. On Facebook, Deb told us no, it should be the individual's decision. Lewis agreed, saying, "My body, my choice." Scott said absolutely. He thinks it's better for public safety, while Christopher added, encouraging it and offering it free of charge, sure. Mandatory, no. Now, we do want to hear from you. Let us know what you think by heading onto Facebook, just like 6 News, and post your comments on our timeline. In the meantime, I should add that Conemaught's new policy will allow exemptions for medical and religious reasons, and for those with certain allergies, there will also be a special alternative vaccine offered. Reporting live, Maria Miller, 6 News.